Welcome back to the Roots Podcast presented by Elite Anesthesia. We have Dr. Barron with us today from Brilliant Smiles. Yeah. And we're super excited to have him and excited.
One of my favorite offices, too.
Mm-hmm.
Yeah, man.
Yeah, we'll keep it. I don't know how much to bring into this conversation yet. So
bring
as much into it as you want.
Shoot, bring it all.
You don't want all of it.
Dr. Barron, how long have you been working with Elite Anesthesia?
I don't know. Probably almost 2 years for sure.
Yeah, 2 years, man.
Yeah.
Yeah, you were one of the originals, too.
I know. Didn't count for much, but how long have you guys been here?
Just about 2 years.
Yeah.
About the same.
Yeah.
I remember the day you walked in my office.
Oh.
Yeah, like real sheepish look. It's not the way you walk in now.
Just
your shoulders are back.
Sight.
Chest is puffed out. I'm raising your feet. No, you walked in, you're like, hey, could you give us a chance? We're here in town. And I, thought, this poor fella, I'm going to try and help. I'm going to give him a shot. And look at the
best decision of your life. That's what you're reflecting on it now. You're like, that's the best decision I ever made.
Moderately beneficial. I don't know, best decision describes it, but yeah.
Your staff says so. Your staff's like, dude, he's like a changed man ever since he's been working with you.
Yeah,
your leadership in his life has been.
That is true.
Finally has a true north to follow.
It's been quite the influence.
A role model.
That's funny.
That's great.
And how long you been in Seattle? So you're not from Seattle, you're from Alabama.
No, I think I've been here
Are you from Alabama?
I am. Heck yeah.
Oh, dude, I didn't even know that.
I know. It makes you a little uneasy, doesn't it? It does. I know. Yeah, it's okay, though. I grew up in New Jersey first. So
okay.
So I'm very, very diverse, very, very cultured.
New Jersey and Alabama.
So, yeah, here I think 16, 17 years now.
Roll Tide?
Well, I mean, I went to Alabama for dental school, but I went to Auburn for my undergrad. So I'm War Eagle.
Snap.
Yeah.
Is that a thing? Do they let people do that?
Yeah.
Yeah.
Only for dental, though.
Did you go to Auburn for dental school?
No, Auburn doesn't have a dental school. So
okay.
I did an engineering degree at Auburn and then went on to Alabama to get my doctorate. So
okay.
Yeah.
So you went to dental school at Alabama?
Yeah.
Okay.
But it's different. So Alabama has like the University of Alabama in Tuscaloosa, and that's like the cool place. And then there's the University of Alabama at Birmingham, which is in the city of Birmingham, and that's where all the medical, dental, everything is. And that is the uncool place.
Oh.
So it's not nearly as fun as Tuscaloosa would have been. So it's not like
Football's not in Birmingham.
No. Yeah.
I got it.
So.
Okay. So then graduated dental school. Did you do a fellowship or did you go straight
No,
into
you know what I did? I took a job on the telephone. It was like, it was this like March of my last year of dental school. And I'm like, I don't know what I'm going to do. And I don't know where I saw it back of like, we have this journal, American Dental Association, this Jada magazine. There's like an ad in the back of it. It's like looking in the back of a Boy's Life or something. There's a little ad for like to work in Alaska. And so I was like, okay. So I called it and I called this guy and he sounded pretty cool. He asked me for my driver's license and my social security number, which I thought was weird.
And you gave it to him.
I gave it to him. I didn't care. It was a different world back then.
More trusted.
And he called me back. He called me back in about 4 hours later, and he's like, you don't have a criminal background, and there are no felonies on your record.
You're not running from anything?
He's like, so you're a candidate to work in Nome, Alaska. And so I told him, I said, look, man, I don't know what it's like there, but I want to do something different, so I'll come for a year. And I promised him a year, and I ended up staying for like 6.
Oh, snap. You were there for 6 years.
6 years, yeah. So
you got some cool stories.
Nah, really baseline stuff, like bear stuff, moose stuff, fishing stuff.
Baseline Alaska stuff.
Airplane stuff.
You fly? No.
No, well, I flew. No, I wouldn't say I fly, but we flew around these tiny airplanes and landed in these native villages and made these like bush clinics and stayed for 9 days straight. And like, that was the weird part. Like there's sometimes the plumbing would freeze for like 3 months of the year.
Oh.
So you're like crapping in a bucket for 9 days. Like that's your bathroom.
Oh, man.
It was really wild. And it's a burnout thing though. I had this one really cool place and there's these 2 islands in the Bering Strait. There's Big Diomede, Little Diomede, and the ice freezes between them. And so you land the airplanes on the ice there. And that was one of my villages, and there weren't that many people there. So I felt like I could control it.
Yeah.
And so, man, I went out there one year and I was like, work. And I was like, man, all these kids, pull them out of school and do all their work and everything. And they got no cavities. And I'm like, man, when I come back next year, it's like, I'm going to go crabbing and this and that. And I came back the next year and it was like, I was never even there.
Oh, snap.
Yeah. So it was
Just not taking care of themselves at all.
well, I mean, it's a deeper conversation, but what did it, was it Reagan who said like the scariest thing you could ever hear is, I'm from the government and I'm here to help. So yeah, their contribution to, it's not been great up there. So
Wow.
anyway,
Man.
but yeah, so it's cool. So yeah, from there, and I kind of got bored of the work. I was just doing a lot of simple stuff and decided I wanted to come out and start working on my career. And that's when I came out, started training, did my IV certification actually in New Jersey again. There's some charity hospital in West Patterson. And so did my implant training in Utah, actually in Heber City. I did a lot of my implant training there.
Who with?
White Cap.
Oh, yeah. White
Clarks.
Cap.
Yeah.
Yeah. Did you work with, I think Mitch Duckworth was doing sedation with them at that time.
I might have, because I've gone there and I've done like we were required to do like an every 3-year brush up, and I think I went. Yeah, was he the guy at Loma Linda? Yeah, he was pretty good.
Yeah, he runs a good program. There's 2. He's a dental anesthesiologist. There's a couple of them.
I was pretty impressed with that guy. I thought he ran a good program. He was the guy who taught me how to bag someone and gave me confidence that I could bag a patient. It was pretty good. But yeah, and so then I just kind of left Alaska, went to South Florida because I wanted to fish and didn't love South Florida, so came to West Coast, and here I am.
So did you buy a practice here? Did you start one?
I did. No, I bought it's a smaller 4-chair practice, and it was actually over here, like I said, on 112. And I just got to the end of that lease and it was too small. I just grew out of it. So I built out a space.
And in that practice, what were you offering? Were you doing general practice and all on X?
No. So,
just implants?
I was placing implants and doing my own sedation and just a lot of cosmetic work and stuff. It's really interesting right now, and I haven't quite figured it out. It's like all of these people just sort of jump into all on X. Like these guys just straight out of dental school. I'm like, it's just, maybe it's the right way to do it. I don't know. I sort of organically placed hundreds and hundreds and maybe thousands of implants before I did an all on X case. And when I did my first all on X cases, I was freehanding them.
Yeah.
And so, and now with the digital workflow, everything is kind of
guided.
Everything's guided. Everything's a little bit easier. And I think that's how guys jump right into it. But well, I had sort of the old school introduction. I placed, before I did my first full arch, I probably had done 1,000 or 2,000 implants. And so, yeah.
Good foundation.
Yeah.
Awesome. And what kind of practice do you run?
It's kind of everything. When I met you guys, or before you, I was doing all my own sedation.
That's right.
And I feel like I have a very appropriate view of like what I should be doing when I sedate people, So I'm permitted, right? What is it? The permit's called parental conscious sedation.
Yeah.
Like keyword being conscious, right? Yeah. And so I think people overdo that a lot, and but it gave me a good basis, and so I think police like when you're in, for instance, I'm always watching your back, making sure you're doing everything right on the up and up, I don't want
supervision.
Yeah. It was sometimes a little mentorship too. Yeah. Things in life.
Yeah. Whichever one's more relevant.
But it's kind of funny because early on I started doing all of my own, and the most frustrating of times, right? Because you're kind of even slower when the more you do this, the faster you get, and the less stress you have because you've done something 100 times, 1,000 times, like it gets easier. But yeah, it's a huge handful to go in and take on the burden of taking responsibility for the medical history, getting them sedated, getting them properly sedated where they're not too deep, but they're sedated enough to be comfortable, and then managing your procedure and maintaining that sedation level. It's just like, it's madness. So, you guys are a godsend as like Elite Anesthesia. And sometimes I wish you were around for the deliveries.
Yeah.
Like the end thing. Because it's quite satisfying in the respect that for me, and dentistry has its problems. It's kind of a high stress, and there's a lot of hats to wear and things, right? And it's sometimes not the funnest career, but now you have this opportunity to give back to somebody what they no longer have. And as it becomes a problem as we age, social settings, family dinners, those kind of things become very important to you. And if you have to do it with a denture with no teeth, it certainly dims the light, right?
Yeah.
So
and you get that stigma placed on you immediately too.
Of 100%.
It's a difficult place to be.
The guys I've had who've come in and who struggled to pay for the surgery, but then they come back and, oh man, I got a better job, or oh man, when I go out and I bid things, there was a cool story out of Utah where a guy was talking about he was just grateful to have somebody agree to work with him to where he had that intervention done, got basically a functional smile back. And like you said, the stigma's gone. And he's sort of bidding jobs for what he's really worth at that point. And so it just plays into this whole self-esteem. And so if you guys are around, and like I always want you guys to see the final product because it's just freaking stunning. And you see how hard I work.
Yeah, for sure.
Right? Imagine me trying to manage that sedation. How long would I be there?
Dude, I know.
I'd be there. It'd be impossible.
It's crazy. I remember this study came out about Ozempic, and it was talking about like how much Ozempic would increase people's salary just because they would be more valued as somebody that wasn't as obese. They would be looked upon differently and so on and so forth. And they rolled out this case study, and it was like, man, the numbers were astronomical, like just across the board. And you've got to believe it's kind of the same concept for people's dentition.
Even,
probably more.
Maybe I'm just biased, but I think for sure more. I mean, I don't know. My heart really goes out to the people who need that. And so it's really cool. And I keep talking about it. And I keep saying to you guys, access to care. And like, there's lots of us who couldn't do what we do unless we had somebody in there managing that sedation. And then coming back into like my opinions on everything, and I never really hide them. Like, if it's not me and you, then it's going to be this teamed effort between, oh man, I'm getting into dirty stuff here. Like, it's this team effort between like a prosthodontist and oral surgeon, which how it was traditionally done a long time ago. And it just gets harder, and you got one guy planning the implant placement and then another guy trying to manage the prosthetic rebuild. When if one guy's planning the implant placement and doing the prosthetic rebuild, if the idea that an implant needs to be tweaked goes in before the implant ends up in a bone instead of looking at it after, and you're like, oh, what do I do with this? And but without you guys,
you're saying that one person doing it brings a lot more cohesiveness to the end product.
I think so. Yeah. I think so. A lot of people would agree with me.
Sense.
A lot of people would say I don't even have the right to do what I do, and that's fine. I'll fight them.
I think that's an old way of thinking.
Yeah.
But it's prevalent.
Yeah.
I mean, but
hasn't gone away, but it's.
Yeah. You don't want to get me going. I think sticking to the point of is you guys make it possible. Like, for me to do what I do for these people and what I'm doing with these people, I think is meaningful. And that's what I really like. Yeah, but going back to it, I'd be selling bait on the end of a pier somewhere. If I had to just like do crowns and fillings, I'd just be like, okay, that's enough of this.
It's interesting, man. We talk about, what it takes away and removes from somebody when they don't have the confidence of their dentition. And it always makes me reflect. I mean, the best stories and the best laughs, the best memories I have in my life are always around the kitchen table. Like, they're always around some aspect of food and drinks and holidays and so on and so forth, man. And it's crazy when we talk to these patients, that's what's been removed from their life the most. They've been sheltered away from that. And often that's what makes it so emotional. Like when they wake up and you show them their new smile, like those tears, I don't even see the final delivery all the time, but I see that initial reaction and it's powerful, right? Because like, I can't imagine not having those memories.
Well, and it's just you don't even have to see their reaction. Like some of the it's dramatic.
Yeah.
Some people show up with a pretty terrible condition, and then by the end of our day, you know, when we look at what we get there, and it's just, yeah, it's awesome. And it is really wild if you really connected the dots on all of this. A lot of what you guys do wouldn't even be possible without sort of digital workflows, you know, and because digital workflows have sort of, when everything was analog, it was so much more cumbersome.
Yeah.
Just to get people to
the range of provider that can do it.
Yeah. They're like, well, it's just, it wasn't even the range of a provider too. Sam Altman-Freed did a really cool thing. He was doing a podcast and I try and remember this all the time because things can be super frustrating, but he talks about a lot of super smart people who are not successful. And he talks and he goes on to talk about, one of sort of the key performance indicators on whether you're going to be a success or not is your tolerance for stress, your tolerance to overcome adversity. A lot of people are really smart and start and they hit the first wall and it stops them. Right. And they're the guys who will climb that wall and climb the next. Doing this in sort of an analog standpoint was like stymieing a lot of really smart people. And so now you have digital workflow. And so now a lot of people, it's just much more predictable and controllable. And I mean, but even at that, there's still a lot of crap.
I've never thought about that, but I've always just attributed kind of our growth over time. I mean, outside of us opening in new locations, inside of our own areas that we're in, the expansion that we see, just to more dentists doing the procedures, more dentists doing surgery in general. But I actually haven't thought about the workflows behind what actually contributes to that being possible.
Well, and it kind of blows your mind too, because going back to the technology, like you said, and then what was sort of the pre to a lot of this, you know, what photogrammetry, like, you know, I don't know for sure, but I know it's the same kind of trigonometry that the GPS systems use. Right. And so, having like global positioning systems and like algorithms and software out of that be applied to, you know, angular photographs. And it's just really wild how we landed where we were, but just a good point. How old are you?
35.
Yeah. Maybe you know, or maybe you don't know it, but these corporate entities that perform these cases, they're new, you know, they're 20 years old, you know, tops. And
we work with them.
Yeah. That's why I hate you guys a little bit. That's why I hate you just a little bit. I don't know why you do that to people, but you know, you're contributing. You know, we talk about contributions, and if that's what you want to do, then
it's what got us started into it, honestly. And my opinions about it have changed over time. It's not
careful.
Something I grew into.
Hand that feeds you, man. Don't gnaw that pinky off, man.
You're the hand that feeds us.
Yeah,
now.
for sure.
We've been down that road before, but whole different discussion.
Yeah, and that's like kind of for you guys, like what I know you do primarily all on, like that's probably got to be the mainstay, but what other kind of stuff do you get called? Every once in a while I'll call you for like a wisdom tooth case or something, but
to be honest with you, this is the most surprising part about this journey that we've been on. You know, I started doing dental in 2018, so it's been 7-ish years. Yeah. Elite was founded in 2020. We were very all-on-X focused for the first couple of years in that corporate all-on-X world. And as we've expanded and gotten more into the general dentist office, the range of cases that we sedate people for has expanded dramatically.
Really? Yeah.
I mean, you'd be shocked at the number of cleanings we put to sleep, amount of root canals, the number of single implants. I mean, absolutely anything. And I think just like you've mentioned, the expansion of care has kind of opened eyes to being able to deliver procedures in the way that the patient wants. If they don't want to be awake for cases, they don't have to be.
Yeah. I've done it. It's a bad idea.
And I think just the fact that it's an option has changed everything. I remember growing up, man, like it's interesting how basketball has changed today. Everybody says basketball is now kind of like this rich man sport where like you have to get training and there's these camps and there's these clubs and, all these things you go to and you have to learn. And in my day, there was just a blacktop, right? Like there was one option, man. If you want to get better, you go outside and that was it. And I think dentistry was kind of the same way. Like, I told my mom, I was like, man, if everybody was tough as you, I wouldn't have a job. And it was just because she grew up in that day and age where like she didn't have a choice. Like she had to get her mind right that no matter what the case was, whether it was root canal, a crown, a filling, 10 fillings, like she was going to get local and that was it. And she conditioned herself to that. And that's what it is. But I think now that we have more options, it's cool that people can choose. And we're getting into general dentistry more. I think that's probably one of the largest sectors of our growth now is people saying, oh man, I remember I flew into Utah and it blew my mind. It was an 18-year-old that was like, put me to sleep for a deep cleaning. And I was like, what?
That's crazy.
I thought it was crazy too.
It's funny.
But for him, he said, dude, I just don't like it. Like, and he had like tattoos. So like, I was like, oh snap. But for this, it was a fear factor. And he was like, why wouldn't I choose it if it's available? And I was like, you know what? I guess you're right.
You guys should get into like some sort of hypnotherapy like that. For people like who do things like that. And when you sedate them, you'd be like, stop being a millennial.
Yeah.
Be tough. When you wake up, when you wake up, you're
man, who am I, right? Who am I to judge, man?
I don't know. Yeah, I know. I am. I wish I felt that way.
I was telling them earlier, I had a dentist that we've worked with for years text me 3 days ago. Said, hey man, I need to talk to you guys. And I was like, oh no, I thought like a case went bad or something. Yeah. So I called him and he's like, hey, I'm getting a root canal done next week. I'm just wondering if you'll put me to sleep for it.
Wow. Whoa.
Dude.
He's like, I've needed it for a while and I just don't want to do it.
Wow,
like,
that's impressive.
Happy to help.
I mean, I guess it's hard for me not to, but I'm not gonna.
I mean, it's kind of crazy. I mean, you see like, a lot of changes just in the space as far as tattoo anesthesia is a thing. You know what I'm saying?
That would be awesome. Have you guys ever done that?
Yeah.
Mm-hmm.
No way, really?
Yeah, we have.
Wow.
That's growing
but
too.
It's crazy because like some people would say the most valuable thing in life is time. And whether it's tattoos or dentistry, like if you were gonna do 25 crowns on a person, how many sessions would you break that into if you were just doing local?
Oh yeah. Probably definitely two. Yeah,
I
could do it one. I wouldn't want to do it in one.
They probably wouldn't want to do it one.
No.
But I've done 25 crowns on a patient under general anesthesia in 6-7 hours. Yeah. And they wake up and they're just like, oh my goodness, thank goodness this is done. Right. So like a time factor, it's crazy. My mom was a single mom growing up, and one of the hardest things to come by was time off.
Yeah.
Like she just couldn't get time off, man. She had me and I was like basically 3 people, So when she had to get things done, she had to cluster it. And I see that so much like in the patient population.
You do make, and like it's a fair point to make in the sense that whoever you're working with can move so much faster when you're there versus by themselves. Yeah. And dentistry is really weird. And I don't know how it happens like this, but for whatever reason, it's compartmentalized and like it's like one thing at a time.
Yeah.
Mm-hmm.
Right. It's like you need a crown. Okay, come get a crown. It's
right.
Like, okay, you need an implant. Come get an implant.
Right.
You need and I've kind of, even in my patient population, I try and give them like the 1 day to done option where they come in if they need their implant or their root canal. I do it all. Not everybody needs to be sedated for that, but just from a mindset standpoint, you're right. The time off and
all that all that matters, man. I mean, the one thing that isn't happening is like things aren't getting cheaper. Like it's harder to get time off. It's harder to make up missed time. So, when we do stuff for general dentistry, I've done crowns, fillings, root canal, and a deep cleaning because they're already asleep and might as well get it done during this one visit. And when they wake up, they don't have to come back.
Well, it's just true. And it's just the mental too for them. Like,
right.
Oh man, I got to go get, and then they go and like, let's say they get a crown done and biology's biology. Maybe there's some variant. Maybe they're hard to get numb. Maybe they don't get totally numb and maybe it's miserable for them.
Yeah. It's a bad experience.
Yeah. And then after
they don't
that,
come back.
Or if they do, they got to like, oh God, I got to get an implant. I got to get this and that. And so, yeah, it doesn't matter when they're going to be sedated and asleep, it's going to be a great experience. No matter what.
Yeah.
It's interesting too. Like, I think one of the things that Dr. Barron does do is like he stays in touch with all the latest. So he'll text me and he'll be like, hey man, like this person was doing their own sedation and this happened, or this such and such, did you hear about this? And it's kind of crazy how common some of these stories are where like just things happen. They can kind of happen fast to practices that have been doing kind of their own thing for X amount of time. I know you've kind of just,
it's what bothers me. What doesn't bother me, but it doesn't matter. It doesn't matter how perfect your due diligence is. Like I always tell patients, they ask me, about implants and failures and this and that. And it's just like, I tell them, I said, this would all be awesome if it wasn't for biology, right? Mm-hmm. We're at the mercy of biology all the time. And there are identifiable, diagnosed or diagnosable conditions. And there are underlying unidentifiable, undiagnosable conditions.
Yeah.
And man, if you encounter that and you're not equipped or prepared, that goes really bad. Yeah. Which is really comfortable. Like, and the thing I really like is where we do it here. Like, I wouldn't do this in Ellensburg or Yakima. It's a hard choice to try and do it there because your response time is so much longer. And so your responsibility to manage the patient all the way through a crisis is just extended.
An emergency response, you're saying. Yeah. You don't have the resources out there to.
No. And I mean, for us, and we've called a couple of times, not for sedated patients, but people walking up to the front desk in chest pain or something. And those guys are, man, they're amazing. They're at my door in 2.5 minutes.
Yeah.
Just
driving around waiting for something.
Yeah.
But and so when you look at it, it's always funny. People love to point the finger at medical practitioners. Every time something isn't perfect, it's, there's some sort of malpractice or something happened. And the unfortunate truth of it is, in my opinion, is like we endure that responsibility and that risk. And like, that's why I really like having sort of the team approach, having anesthesia there, having properly trained assistants and even like, I think to a certain degree, properly trained doctors, but
it's being prepared for the unexpected too. Like how many times do patients lie to us?
Oh yeah, absolutely.
Dude, all the time.
Oh, are you kidding? Yeah, I know.
Yeah. Me and you banter about it all the time. And it's crazy, man. I think if patients were always completely honest about everything they're doing, everything they're taking, every extracurricular activity, then it would be so much easier for any practitioner to care for them. But I think the reality of today is that's not the norm. And
people feel ashamed for some reason.
People feel ashamed. Yeah, man. Like there's a stigma.
Think we're there to get them in trouble or something.
Yeah, like they think you're going to report.
That's me 100%.
Yeah, right.
I mean, I'm there to judge and shame you, even when I walk in like a hygiene room. If you haven't flossed your teeth, man, it's
don't lie to me.
Oh man, I'll stand a little. I'll be like you. I'll puff my chest out. I'll stand a little taller and be like, "Really? No flossing? Come on."
My teeth bleed when I get flossed.
Oh man, but I think that is the biggest thing, and I mean, we even encounter it a lot as anesthesia providers, man. Like, something doesn't look right, and how do you manage that situation? It's definitely a part of the craft, and I know. I handpicked my team here in Seattle, and one of the things that I wanted was a lot of experience. I wanted a lot of exposure to kind of what's happening in the real world, because that's what you encounter all the time in these outpatient settings.
Yeah, it's definitely a part of it. And like goes back to like myself and having my own experience sedating my own patients. It's terrifying. And it's funny because I'm always asking you questions when we're in there, right? I'm like, James, what is that? What's going on there?
He is super attuned to like the pulse ox. Like he'll hear it be like doo doo, and
but then a lot of times it's not anything,
right?
But when it's just kind of funny. This is embarrassing to admit, but I've invented my own realities. Like I've decided that Versed, contributes to like cardiac arrhythmias, and it's probably just because my monitor is, the patient moves around a lot or something. I'm like, oh, what's that? And yeah, it's really hard, and having to, you have to be overly cautious when you're there by yourself, and it's just, and then I think what we're landing in on is just what's appropriate and what's not appropriate for ethical behavior and how should we be taking care of our patients. It's just no one can argue that it's as safe my sedation training was like probably 120 hours over the course of like 3 weeks. What was your sedation training?
Super intense, man. I did 5 years in ICU and then 3 years in anesthesia. So,
So, you just can't argue. Like, if it were me or my family, what would I want? Would I want a single practitioner doing the anesthesia and the procedure, or would I want a team of people? And it's just.
You called me this weekend.
What did we do this weekend? I don't remember.
You were like, "Hey, will you do the sedation for my daughter?"
Oh yeah.
And I was like, "Hey, man, that's always a badge of honor." When,
there's no way.
Yeah.
No way would I sedate my daughter and do that surgery. It's crazy.
Yeah.
I probably shouldn't even be doing the surgery, but we'll see. Yeah.
What do you like in terms of deciding whether or not you're going to do your own versus work with somebody like us?
So since I've been working with you guys, a lot of times I did a lot of my own IV stuff, and now about the only thing I'll do is oral conscious sedation, which is like a 2 staggered doses of an oral med like Halcyon, maybe Valium if it's a longer procedure. But that's all I want to mess with, because I consider that super safe. If it's not super safe, I think, from management of complications, if I had to bag a patient for 3 minutes until paramedics got there, I'm very comfortable doing that. The probability of having to bag a patient for giving him Halcyon is pretty low. It's possible. It's pretty dang low. So if I'm doing like a veneer case or an arch of crowns or something like that, I'll just do some oral sedative and that's it. And I have kind of in my tool chest, it's like if it's not working and they're on the monitor and their heart rate's ticking along too high and I know they're just freaking out. I can put an IV in and give them a little bit intravenous, but never again will I try and sort of land the airplane, hook them up, put an IV in and sit there and try and get them to like 5 or 6 milligrams of Versed, 100 mics of fentanyl to try and put them in some spot. Which the other frustrating thing for me is with those drugs and the drugs that I'm allowed to use, they're unstable in the sense that they don't stay in that spot.
Yeah.
And so
very short acting.
That's what I mean.
Yeah.
So, and so then I've got to go and try and work and get this done. And now they're starting to fidget and I can tell I need to manage this and it's just not worth it.
Yeah.
So
that's a lot to think about. I can't imagine. It's a lot for us to manage. Dental's pretty reasonable in terms of an anesthetic, but to think about that and then something that's 100 times more complex, like an all-on-X case or veneers.
Well, and also think
about.
It's impossible. And think about like the just reaction time in decisions. Let's just say you have some usual and customary like a hypertensive crisis. Just the reaction time to sit there and be like, well, do we get a beta blocker? And I don't give people beta blockers, so I don't know how to mix it up in an efficient way, and I haven't delivered it 1,000 times. It's just inappropriate for me to manage something like that, in my opinion. People will think differently, of course, but I just don't have to do it.
Yeah,
because you guys are here.
It feels like dentistry is kind of in a transition period right now, where there's like an evaluation going on of what should or shouldn't be done, and I don't know that it's all entirely like greed driven or ego driven. I think some of it came out of necessity.
For sure.
I mean, Elite Anesthesia wasn't always here.
Right.
And implants and all NX has been going on for much longer than that.
It's true. And I think even from the standpoint of like an access to care standpoint, and I didn't know if it's just me and what I do in my career, why I'm doing a lot more sedation cases, right? Or is it something that's just becoming more common throughout the entire field? I mean, I personally think you guys have contributed a lot to it. I don't know if you've thought about it or if you know, but how many anesthesia practitioners have you made available to dental practices in this state? You know, you guys must have the same number of people under your roof as maybe there were in the entire state when you showed up. And so access to care and getting somebody going, it is changing, but I think you can't ignore the fact that some really sad stories have come out of some very credentialized individuals, you know, situations where you have anesthesia and pedo, or you even have, you know, oral surgeons, MD oral surgeons who have terrible outcomes. And it's, you know, you don't want to judge anybody's operation from an armchair, but when you hear and you read about things, a lot of times it's just complacency.
I don't even know if it's complacency, man. I think it's so interesting. You can have the same letters behind your name and have completely different skill sets behind that. I came from an anesthesia group that didn't train specifically for dental when I first started. And I had already had like 10 years of anesthesia experience, and I got thrown into this dental space, and I didn't necessarily know completely what I was doing. And I was figuring out on the fly, and I learned a lot, but like there's also a learning curve, right? And I remember when I signed up with Elite, after that experience, they were like, "All right, man, let's get you out to Utah." And I was like, "Oh, for what?" And they were like, "Oh man, we're gonna train you up." And I was like, "Oh no, I've kind of already learned. Like I've learned on the fly, and I figured things out, and I've been practicing for 12 years at that time." And Sean was like, no, we're gonna get you trained up the Elite way. And I flew out there, man, and I was like, oh, what am I really gonna learn? Dude, I learned a ton. Like there is such a difference in anesthesia in the outpatient setting versus the hospital. Like somebody that does anesthesia full time at the hospital, 90% of the time and does this on the side, they're bringing kind of hospital anesthesia into the outpatient setting, and it's just completely different. So like I think, it's so crazy how, people are like, oh yeah, I use an anesthesia provider, or I use a sedation provider, or they have a little bit of experience, but it isn't the same, man. I think kind of one of the cool things about Elite is it's definitely specialized for the space.
Yeah, and I think it has to be.
Yeah.
When you think about it too. And I mean, it's not that hard for me. I mean, I just try and set ground rules, and I always call you stupid questions.
No, they're not stupid questions though. Like
but I'm like, hey man, I don't know this. I know I have this certain patient, and I have this like BMI concern or something like that. Is that appropriate for the setting? But I think you can never lose focus of what's appropriate in that setting.
Yeah,
because you're not going to necessarily. And I don't even know if you guys do. Do you guys have crash guards?
Yeah.
You have a crash guard.
Yeah,
so if you had to defibrillate somebody, you could defibrillate somebody in there.
Yeah.
That whole thing's a crash cart.
Yeah. And that's, and that's deeper than I ever want to go on it. But for me, it's always like, you just follow the ASA rules.
And I think I think more than anything, it's kind of crazy, man. Like a lot of stuff has been done in the outpatient setting, but dentistry is kind of the first where it's like, it's a unique space. I mean, for the most part, like a lot of surgeries were always done in hospitals or ambulatory surgery centers. And then dentistry comes about and we're doing it in the office. And it's like, man, how do we bring that safety standard to the office? And there's just all these moving parts. So it's kind of cool to kind of hear from you and your perspective. And
well, even when you think about it too, like think of like the contribution to access of care. Because man, when you got to take somebody to a hospital, oh God, it's impossible. And then the other thing is, it's like once you have to go to the OR, I can't go to the OR. Right. I can do all of these things, but now all of a sudden, who can go to the OR? Well, what if they need to be sedated for something, relatively benign, like an arch of crown preps or something?
Yeah.
you can take them to the OR for that. Then who's going to be the practitioner in the OR? Well, an oral surgeon is not going to do it. Then you got to find a prosthodontist who has, or dentist who has OR privilege, and hospitals just don't operate that way. So it's just incredible contribution to access to care. I think is really cool.
Yeah, absolutely, man.
So what's next for your practice? Are you
I
got
don't
big
know.
plans ahead?
I don't know.
He's trying to marry rich.
Oh, that would be awesome. No, come on, easy, safe space. Yeah, no, I have no idea. The Mary thing. Not for money, for love, James.
For love, man. I believe it. I'm a classic guy too, man.
Yeah. We're sort of have a relationship trying to come together. It's kind of interesting. She's in London. And so
she's in London?
Yeah.
Okay.
And it's really difficult. She has a business in London, and a really interesting thing that would be really hard to recreate anywhere else. And so I've even looked at potentially practicing in Europe over there. I don't know. But it's funny, when I approach that, I'm kind of like, man, the first thing I thought, I was like, who's going to sedate my patients, or can I even get my patients sedated? And so
We've talked about going international. It might be the time to think about it.
Dude, I'd practice.
Those Brits, they need help.
Dude, so that's the thing. You wouldn't have any shortage of patients.
The Brits, whoa, did you just say they did? Awesome.
Is this thing on?
With anesthesia.
It's all right. When I go there, I'm like, look, man, tea party's over. I'm here. It's safe. Don't worry.
I can confidently say there are very few British people watching this podcast.
Yeah.
That is true. And you know what? If they were and they could find us, they're actually some mean, like, quick to swing guys.
Yeah.
So I just get
We'll deal
behind
with that when it
James.
comes.
And be like, just kidding, James. Yeah, no. So I don't know. This is awesome, and I love doing what I'm doing. And as long as I feel like I'm helping people and making a real difference in their life, I think it'll keep me in it. But it's challenge. You guys maybe don't feel it. It's a challenging climate, and it just seems to be becoming more and more challenging. Like I just don't see things swinging back. And I'd love to dig on Washington State and the tax implications they're making, but they're not making it easier for small business and things like that. So I don't know. So I think for me, as long as I get that I've done something for someone that I feel like very few people could, and I really feel like I've helped their life, I'm going to keep going. And until I feel like I fall off that plateau, man, and I'm not performing the way I need to perform, and then I'll be done. I don't know.
You know what's crazy, man? So this is like legit my guy. Like this guy, he's one of the practices that not only do I love going to because we just have the greatest banter, but he also really cares. It's one of those practices where he's always willing to go that extra mile. We had one of the toughest patients ever. Like, not only was she tough from the surgical standpoint, but she was tough from like the emotional standpoint.
Oh God, don't even tell this story.
But it was crazy because, she didn't follow any of the post-op rules. She didn't do anything that she was supposed to. And the next day, this guy lives in North Bend, which isn't close at all. And he bought her food and delivered it to her all the way back in Seattle. Oh man, you just don't hear that a lot. Like you don't hear that kind of like, you know what, man, I'm going to see this through to the end. This patient just needs that extra TLC. And he has this rough exterior because he's from Nome, Alaska, and like he's been in Alabama, but like, Birmingham. But he is like a tender heart at his core.
You hope I am. That's not true, man.
Because I've seen it, man, and I do value that because at the end of the day, like that's what it really takes to deliver care today. Like it takes doing what it takes for each and every patient. And not all patients require that, but when it's necessary, man, it's good to have it in your tool belt to deliver it because at the end of the day, like we want the results. We want the patients to be satisfied. We want them to get whatever they've paid for, man. And it's cool to be kind of in that ring with you. It's I would say it's a tough, your practice is in Bellevue. So like I think that is kind of a harder area, right? Because it's more of a high-end area. Like, I think marketing becomes a bigger tool.
Well, it is, and it's kind of interesting, and I probably shouldn't say too much. We're a little bit unique in what we do in like the all-on world, and so we're actually reaching out and to we think some, I wouldn't say starving markets, maybe some underserved markets, and definitely markets where the kind of surgery that I do doesn't exist, and we're trying to create sort of we're trying to reach out to hubs.
Brits.
No Brits. No, I'm not reaching out to the Brits, man. They're too mouthy. Can't do it. So yeah, we'll see.
So where's your practice headed? Is it like where do you see your practice in the next 5 years?
More of the same, really. You know, I really feel like, and it's kind of weird. I don't like to compliment you, but I will. And it's like, you guys have really helped me reach kind of like the pinnacle of what I think. I mean, it's really cool. There's a lot of dentists who went their entire career who can't really say I've like helped somebody repair their self-esteem and their confidence, and I made them more job worthy, and I made them, you know, I did all these emotional things for them, and I'm really proud of that, and I don't need to. I really don't need to go on to anything else. And because for a long time, I just was hungry and I wanted to do this thing and the next thing and the next thing. And that's how I kind of landed here. But now, like working with you guys, I'm in just such a comfortable spot where I feel like we're taking the best care of patients. You know, we're making great decisions on what we're executing and where we're executing it. And we're making this great difference that I just sort of resigned myself to just more of the same at this point, and just you know, repeat and just, you know, find good people and try and help them, and that's all I want to do.
And it's cool, man. I think you've nailed in your marketing. Like, your new marketing campaign is really awesome, and like your volume's going up, and it's kind of cool to see like us work together, and you know, you kind of like dial it in to where I can definitely tell you love doing surgery like more than anything else. So to be able to do more of it and do it at a high level is pretty cool.
Yeah, no, I think it's cool, and it's funny. Where else are you guys? You guys are here, obviously. Salt
Lake, Denver, Phoenix, Seattle, Oklahoma City, Dallas.
Oh my goodness. Yeah.
Minneapolis, Houston, San Antonio, Austin.
Whoa.
Chicago.
So how many of you are there?
Between full-time and part-time, we're like 150.
Wow.
I think.
That's unbelievable.
Yeah.
That's like, yeah, that's crazy.
And what's cool too is, I mean, like the need for what he does is beyond Bellevue. I think he's had aspirations, you know, he's always bounced up. I don't know how serious you are, but he's like, what if I moved over here? Would you guys come with me? And I was like, yeah.
I do look at that, and you can't help but do that. It's the greener grass syndrome, you know.
But it's kind of cool to know that we're mobile enough to like,
yeah, we'll go where you are.
Dude, we'll go where you are.
Well, and it is funny that you say that, because my like latest campaign, like to reaching out to underserved areas, I actually am just not real smart with things sometimes, and I was like, yeah, let's maybe let's look for a good market, and then let's test run some marketing, and you know, if I think there's a great need there, then I'm going to go find a facility and go there.
Yeah.
And my marketers are like, it's a $500 airfare.
Yeah.
Why don't you just recruit them into what already works? And so hit that market hard instead of doing like a test thing. Hit the market hard, you know, differentiate yourself in your marketing for how you are and what it is different about what you do, and try and pull them in and help more people that way. And so that's kind of where we're at with it.
I think Randy, I mean, I don't know exactly at this point, but I think 80, 90% of his patients come from
sometimes
state.
Randy, sometimes like I'll be at my house and like I'll be like grilling steaks and like potatoes, and I'll make my plate and I'll go over and put it on my table, and I'll walk away and I'll turn back around and Randy will be there and he's actually taking steaks off my plate. It's just so
you watch your back.
Yeah, you gotta watch them, man. They are Randy and his brothers. They're everywhere.
Yeah, that's awesome.
But it shows you that that's a successful way to go about it to a certain degree, right? So like a proven concept.
Yeah, I do think so. And I don't know, we'll see what happens. But my deal is I'm operating from one challenge in a case to the next, and just find me a good person who needs it and let me try and help them, and that's it.
I think at the end of the day, we're all trying to feel satisfied in our careers, honestly. I mean, we do it all day, every day. And I share very similar feelings to you, where before Elite, for me, I was bouncing around a lot. I think I looked at jobs
Everywhere.
all day long while I was in my job. And there's just so much satisfaction in this that I mean, obviously I own this company, but very early on, I was just like, this is very satisfying. I enjoy doing this, and I can't see myself doing anything else.
And I don't know for you guys, but it's got to be different. Like the hospital environment for you guys has got to be
It's awful.
A little bit of soul crushing.
It's awful.
Yeah. And what are you trying to do? You're trying to keep a very sick patient, alive for the duration of it. You know what I mean? You're not part of that.
Keeping someone alive versus delivering something that's a life-changing experience for them. It's two
Really
totally different things.
Yeah.
Yeah. It's really fun to be a part of.
Yeah, that's what I would. Yeah, I think so. I would be into it too. Yeah, and so it sounds great. You make it sound awesome. So there's a anesthesia school in Tijuana. My application's in. So
He always talks about.
Can't wait.
Yeah, dude.
It'd
It'd be awesome, man. We'd get you on board, bro.
Can't wait, man.
So if there was anything next other than what I thought, golden slippers.
Yeah,
work for my golden slippers.
We'll take you. Well, Dr. Barron, this has been super fun, man.
Yeah,
Appreciate you coming and working with us. And
thanks,
Absolutely.
man.
all right, Dr. Barron, thanks for joining us, and we'll see you guys next time.